everyone, and welcome to the MedSynapse Podcast. I am Dr. Simran Anand, and today we have a distinguished guest with us, Dr. Narinthorn, an internationally recognized expert in wellness, anti-aging, and longevity. Dr. Narinthorn graduated with a medical degree from Mahidol University in Thailand, and he holds an MBA from Chulalongkorn University. He is board certified by the American Board of Anti-Aging and Regenerative Medicine and has completed a fellowship in anti-aging and metabolic medicine. With his extensive experience and passion for helping people look and feel their best, Dr. Narinthorn is at the forefront of advanced anti-aging treatments and wellness plans. Dr. Narinthorn, thank you for joining us today.
Thank you. It's my honor to join this event with MedSynapse. And I like to share my knowledge and my experience about longevity. And I think today we will talk about the hallmarks of aging, the mechanism and process that make us get older in the cellular level.
Thank you so much. So moving ahead with this, at MedSynapse, we are committed to exploring cutting-edge topics that impact healthcare globally. Today, we are diving into the hallmarks of aging, a fundamental area of research that affects us all. Doctor, let's begin with genomic instability. We often hear that DNA damage is a cause of aging. Could you shed light on how genomic instability contributes to aging and disease?
So when we talk about the hallmarks of aging, we have to back to 2013 in Copenhagen. That's the first start that we talking about the process that make the people get older in the cellular level. Now the character of the hallmarks of aging is the manifest in during normal aging, and the second is experiment. If we experiment accelerations of it can accelerate aging, and if we can delay or retard the process, it can increase the health span. This is a concept of hallmarks of aging. And in 2013, there is only about 9 hallmarks of aging. And in 2022, they introduced another 3 hallmarks of aging. And the first one is DNA damage or genomic instability. So in every day, our body inside our cells, there is always have a DNA damage. And the most cause of DNA damage is come from external source and internal source. The external cause of the DNA damage is come from the radiations, UV, X-ray. It's come from chemical, carcinogen like cigarette, processed food, cosmetic and cleaning product. And it's also come from infectious agents like virus, HPV, or even COVID and bacteria that can create the DNA damage. And normally our body have the process that can protect or repair from the DNA damage. In our body, in every day, we may have a DNA damage, more than 100,000 lesions of DNA damage. But if our process of DNA repair is work properly, it can make the cell back to divide into the normal environment. But if the DNA repair is not good or is malfunctions, it may have some problem with our body, like we may have aging disease, or we may have risk of cancer. Actually, DNA repair is one of the Nobel Prize in chemistry in 2015. And the cause of the DNA damage, there is many cause or many types of DNA damage. It may have some type of DNA damage. It's a single strand break, double strand break, base repair or cross link. Now all of this the process that happen every day. But our DNA repair mechanism, we have a base excision repair or BER, nucleotide excision repair or NER, mismatch repair, and homologous end joining and homologous recombinations. Now, this is a process that happens in our body. But the key of these hallmarks is we have to prevent or protect our cells from DNA damage. Now, so we have to use sunscreen. Now, we have to avoid pollutions. Now, and we have to avoid all the carcinogen like heavy metal, lead, arsenic, aluminum, cadmium, and mercury. And we have to avoid the popular trend right now is we talk about microplastic. Microplastic is another key that can destroy our DNA. And infections like COVID. Many people have the problem from long COVID. HPV, HBV, hepatitis B, hepatitis C, all can create DNA damage. So we have to be aware and prevent, protect ourselves from this damage. Another point that we have to deal with this hallmark is how we boost our DNA repair process in our body. Now we can support our DNA repair process by nutritional support from antioxidants, vitamin C, vitamin E, and selenium and flavonoid. Now this can help to reduce oxidative damage to our DNA. Now, polyphenol in fruit, vegetable, green tea, black tea, or red wine. This can help to support DNA repair mechanism. Folate, vitamin B12, omega-3 is all important for DNA synthesis and DNA repair. And zinc is also important too. Another part that I always recommend and give advice to my patient is lifestyle modifications. Regular exercise. Exercise is the key that can support every hallmarks of aging, not only genetic instability. Sleep is also crucial for DNA repair and cellular maintenance. Stress management is also important. And other supplement that may support DNA repair is NMN that can be precursor to NAD+. Coenzyme Q10 is also important, and curcumin. Curcumin is also good for DNA repair. So this is some brief about genomic instability and DNA damage preventions and DNA repair process.
Understanding DNA integrity is crucial indeed. Moving on to telomeres. Can you please explain the importance of telomeres and how their shortening affects our cells? Are there any promising strategies to preserve or even lengthen telomeres in clinical practice?
Okay, first we have to know what this telomere is. Telomere is the cap of at the end of the chromosome. Its functions of the telomere is first it can preserve the information in our genome. It can help for chromosome stability. It can help for the cellular lifespan and cellular response to stress. And it's linked to aging and age-related disease. Now, when we start of the telomere, when we born as a baby, the base pair is maybe around 15,000 base pair. But when we get older and older, when there is more and more divided of the cell, the base pair of telomere will be shorter and shorter. So what we have to deal with it is how to we delay all of the telomere shortening. There is many factors that can make telomere shortening. Aging, stress, obesity, smoking, viral infection, chronic infections, hormone imbalance, alcohol consumptions, and even air pollutions. But we can support and help our telomere by increase the telomerase. Telomerase is the enzymes that can increase the telomere length. But if telomerase is too much, it's also not good because it may link to cancer. And what we can do is we can add more antioxidant, vitamin intake, stress management, and again exercise and caloric restrictions. The rate of telomere shortening may come from external factor that like toxin, radiation, smoking, obesity, and internal factor like DNA replication error, oxidative stress, telomerase deficiency, and inflammation. So how can we help to improve the telomere or delay the shortening of the telomere? Is caloric restriction or intermittent fasting is also help, but we have to make sure that our caloric restriction still have optimized nutrients, not only fasting and don't have enough nutrient, vitamin and mineral. Now we have to add antioxidant, fiber, and healthy fat like omega-3. Quit smoking, reduce body weight, exercise. And there is some research show that if we do practice meditations or mindfulness program, it also help to delay the telomere shortening. If I summarize the supplement that is good for the telomere is first is omega-3. Second is there is one paper show that coenzyme Q10 together with selenium. After take it for about 42 months, it can help to delay telomere shortening. Now, vitamin D is also important. Try to keep vitamin D level around 50 to 70. I personally take vitamin D about 5,000 units every day because we work in only the office and not enough sun exposure. Vitamin C, vitamin E are also important. Vitamin B complex, B6, B12, and folic acid is also help for almost at least 6 hallmarks of aging. Vitamin B complex is very important. But like B12, we know that if you are the vegetarian or if you take some medicine like PPI or diabetic medicine, it can or alcohol, it can block the B12 absorption. So in this group, we have to make sure that B12 is enough. Lutein supplement that we know is about health for the eyes, but it's also health for the telomere. And NMN, this is another supplement that help many hallmarks of aging. So this is all about the telomere.
Fascinating insights into telomere biology. Now let's discuss epigenetic changes. How do these changes occur and what impact do they have on our health? Can lifestyle modifications or new treatments help reverse these harmful alterations?
Yes, epigenetic is the trend right now too. Now, if you read the book Lifespan from David Sinclair, or we follow the other longevity experts, they all talk about the epigenetics. Now, after the whole genome sequencing, after the Human Genome Project, once we know how to importance of our genetics, then they move to epigenetics. Epigenetics means that is above genetics, is a switch that turn on and turn off of our genetics. Now, our phenotypes is come from gene regulations, and gene regulation is come from genetic and come from lifestyle and environment. So mechanisms of epigenetics, we divide into 3 mechanisms. The first is DNA methylations. Second is histone modifications, and the third is mRNA degradations. With these 3 mechanisms, it can turn on and turn off our genetic. Like for me, I have the genetic of lung cancer in my family. My mother have lung cancer at her age is 46 years old. My grandfather have lung cancer at 60 years old. So I have that genetic in my body. But with epigenetic, I can have the no cancer in my life. With lifestyle modifications, avoid cigarette, avoid PM 2.5, regular exercise. So epigenetic is very important. But another role of epigenetic is we can use epigenetic as a biological age. Now we can detect the DNA methylations, and we can know that in each organ in our body, what is the biological age in each organ. Now, like brain organ, brain age, heart age, liver age, inflammation age. And once we know this, that which organ is older than our chronological age, that's the target that we have to focus. Like we have to reduce our inflammation, or if it's related to brain age, we have to focus to the amyloid beta and tau protein that may link to Alzheimer in the future. So the role of epigenetic is more and more, but mainly that we use the epigenetic. We will talk about lifestyle modifications, exercise regularly, and try to improve the VO2 max, and also measure your body composition to reduce percent body fat, and try to maintain your muscle mass to prevent sarcopenia. For the nutrition, caloric restrictions. Again, caloric restriction is in almost hallmarks of aging. Mediterranean diet. If you watch the documentary of Live to 100 about the blue zone in Netflix, they talks about the character of the people in blue zone. Mediterranean diet is one of the character that they have a Mediterranean pyramid. The base is physical activity, and followed by grain, fruit, vegetable, and then protein from seafood, from fish, and lean meat at the top only once a week. And in the Mediterranean pyramid also have wine one glass per day. But now wine and alcohol is not good for longevity at all, because if you like to get the resveratrol from wine, I take one capsule of resveratrol is equal 10 liters of wine. So there is no excuse to take wine for health and for longevity. Environment is also important. PM 2.5 can trigger your genes. Infections, you have to avoid infections. And emotional health is also important. Religions, meditation, spiritual is very important. Now I practice meditation 3 to 5 minutes every day. Just only the point to make sure that I have no excuse, because only 3 minutes. So it's make me have discipline. But when we sit to do sitting meditation, we can sit longer than that. We can go to 10 minutes, 15 minutes. And this can help to adjust your brainwave to sleep better. Epigenetics, now there is some pharmacological that can link to histone acetylations and DNA methylations. We know caloric restrictions can stimulate AMPK, NAD, sirtuin-1, and FOXO-genes. We know that polyamine, folic acid, and B12 can help for the DNA methylations. And now we have to talk about gut microbiome. Actually, gut microbiome is another of the hallmarks of aging, but it's also linked to epigenetic. Many people talk about statin. What is the effect that it can help for the people to reduce risk of mortality rate? But one of the mechanism of statin is can help to improve the DNA methylation too. Resveratrol, curcumin, rapamycin, and metformin. All of these can help for epigenetic by like metformin and rapamycin can block mTOR pathway. And to block mTOR pathway, it can reduce histone modification, histone acetylations. And EGCG in green tea is also good. And I think in the future, they will have more and more supplement or molecule that can help for epigenetic. So the supplement that I personally take every day is NMN. I take that's about 500 milligram. Even David Sinclair, he takes about 1,000 milligram. Brian Johnson, he take both NMN and NR. So this supplement, I think, is quite compromised, and it can help to delay aging. My patient who take NMN, they notice that their energy, their metabolism is very good. Someone asked me that why her LDL level is go down. They don't change anything but take only NMN. And NMN is also good for adjust biological clock or circadian rhythm. It can help to sleep better. Even you take it in the morning. And now we can do the test to check NAD plus level in the blood, in the cellular level. And there is a paper published a few months ago. Notice that B12, B3 and their derivative may have inflammation to the heart, but they don't inform that what is the dose, what is the level and durations. But if now we can test NAD plus level, we can make sure that when we take NR, it cannot too much and create inflammation to the heart. So this is all about the epigenetic.
Thank you for clarifying the role of epigenetics in aging. Let's move on to nutrient sensing pathways. How do these pathways change as we age, and what implications does this have for age-related diseases? Can dietary interventions like caloric restrictions benefit these pathways?
Okay, so to talk about these hallmarks, the regulated of nutrient sensing. Nutrient sensing is sensing for mainly it's macronutrients. When we think in the ancient time, when we have to go out to hunt for the food, they have time of lot of food that we can take, and they have time that we have to starve because it's in winter or we cannot hunt any animal to take. So our body try to survive. Our body, when we get have carbohydrate, have protein, it will trigger in mTOR to work, to function, to produce more protein, to produce more fats. But at the same time, when we produce more protein and more fats, it also produce inflammation at the same time. So during the starving, it's the same as intermittent fasting or caloric restrictions. They will stop or inhibit mTOR pathway, but they open another pathway that we can trigger AMPK, NAD plus, sirtuin-1, sirtuin pathway, and go to phosphogenes. What happens when we go to this pathway? It can help to improve the autophagy. It can help for lysosomal biogenesis. It can help to improve the mitochondria biogenesis. So with this pathway, it can help to recycle the protein, the substance in our cell to reuse again. And with this, it can eat some cell that too old. It can clean out the senescent cell or zombie cell. And with this concept, once we go back to our era, we can eat all the time. we can go to convenience store at midnight and eat, and we ruin our circadian rhythm. When we eat sugar or carbohydrate, it will increase insulin. When we eat protein, it will increase IGF-1. So this is the insulin IGF-1 pathway that can trigger the mTOR pathway when we have nutrient excess. But once we have caloric restrictions, it will inhibit insulin IGF-1 signaling. It will inhibit mTOR signaling. It will increase the NAD plus and sirtuin and MEK pathway. So this can help for longevity, and this can help to lower your cancer risk. And we know that if we stimulate the mTOR pathway, it will increase many risk of many disease, cardiac disease, atherosclerosis, neurological disease, inflammation in the body, fat that can deposit in the muscle, and at the end is go to sarcopenia, nephropathy, renal disease, diabetes, fatty liver, and fat deposit in our body. And if we talk about caloric restriction pathway that trigger the AMPK, NAD, and sirtuin. Now there is about 7 sirtuin 1 until sirtuin 7. But the most popular research will focus to sirtuin 1 and sirtuin 6. So for sirtuin 1 is vascular protection, reduce inflammation, reduce senescent cell, reduce reactive oxygen species, as it's good for protect our DNA. And for sirtuin 6, it can increase the lifespan, reduce inflammation, and reduce oxidative stress. And now there is many supplements that focus to sirtuin pathway. Some is sirtuin 1 activator, some is sirtuin 6 activator. But when I take care of my patients with these hallmarks, first I have to go back to their lifestyle and talks about their meal, their caloric restrictions. So I focus to have a balanced diet with high protein. But if you have too much protein, it will increase too much IGF-1. So I try to give proteins about only 1 to 1.5 milligram per kilo. But they have to exercise. If you take high protein without exercise, it will create inflammation in your body. And we try to increase the autophagy and try to block mTOR. So I give metformin to my patients, especially they have pre-diabetics. But the one who don't have diabetes and you take metformin, you may have some side effect, like it can reduce exercise performance. It may reduce the testosterone level. So if you plan to take metformin, you have to be aware about this side effect. The rapamycin is another longevity supplement that have many research and paper support that is quite good. But rapamycin, if you take it like not every day. It's not the same to the one that have kidney transplantation. But for rapamycin, we have weekly dose. There is many doctor that use rapamycin. You can listen to the YouTube or podcast of Dr. Alan Green, the one that use rapamycin for I think almost 5 to 10 years already, and have thousands of patients that use rapamycin. Now, I personally use rapamycin, but it's a little bit expensive. But rapamycin can lower your immune function. So during you get sick or get infection, you have to stop rapamycin, and you may have a sore in your mouth if you take rapamycin. And resveratrol, I think this is one of the good longevity supplement that can help for your heart, your brain, your kidney, and your blood vessel. So metformin, rapamycin, and resveratrol, I think this is the supplement for this pathway. And NMN is another one that can help for longevity. But the main point is about lifestyle again. You have to exercise. You have to have intermittent fasting. Don't eat anything after 7 p.m. And enough nutrient. The supplement that may support these hallmarks: rapamycin, metformin, resveratrol, sirtuin activator, berberine, quercetin, curcumin again. Curcumin is in many hallmarks too. EGCG, NMN, and omega-3. Omega-3 is another supplement that important in many hallmarks. So this is about nutrient sensing.
Very insightful to know all of this. Now let's explore mitochondria. How does mitochondrial dysfunction contribute to aging process? Are there any emerging treatments or lifestyle changes that can improve mitochondrial health and function?
Okay, so mitochondria is a fundamental organs in every cell. So many disease is come from mitochondrial dysfunctions. All the aging or the degenerative disease is linked to mitochondrial dysfunction. Even cancer is also linked to mitochondria. The one who lose their weight and have the cachexia is linked to mitochondria because it's related to the Wahlberg effect. Now, one molecule of glucose cannot produce 36 ATP. It's go to the anaerobic pathway to go to pyruvate and have only 2 ATP, and that's why they eat a lot, but they still lose their weight because they cannot produce efficient ATP from mitochondria. So mitochondria is our source of energy production to get ATP. It's balance our calcium. It's help for the autophagy. So autophagy can work properly or not. It depends on mitochondria functions and its regulations of our immunity. And it's also support for stem cell regulation too. So when mitochondria function not proper, energy in the cell may not good, and energy in the cell may not good, then functions of the cell and it's go to organs of the cell. Now I read the book, this one, Good Energy. So by Dr. Casey Means, it talks about good energy is mean energy from mitochondria. So if you like to read more about mitochondria, this is one of the good books that you should read. So back to our mitochondria in Hallmarks of Aging. If you have only mitochondria dysfunction, it will disturb all of other hallmarks of aging. It can create cellular senescence. It can make you have stem cell exhaustion, alteration of intercellular communication, genomic instability, telomere shortening, epigenetic, proteostasis, and nutrient sensing. So if I have to choose which one that I need to focus to fix is mitochondria. So we prevent DNA damage and we focus to improve mitochondria, and then other function will gradually increase. But mitochondria function is gradually go down when we get older, the same as the level of NAD level. NAD is work closely with mitochondria. So when we get older, mitochondria is go down. But back to nutrient sensing in the previous hallmarks. Now we can increase the mitochondria biogenesis by caloric restriction, by NMN, by NAD. So once we increase that, mitochondria function will be better. And we don't want our glucose produce ATP by not past the mitochondria. Because with electron transport in mitochondria, we can produce 36 ATP. And if you imagine that mitochondria is the factory that older than 40 years old is come out with pollutions, like a bus in Bangkok. Some bus in Bangkok is 30 years old, it's very bad smoke.
Yes.
It's the same as ATP. So we like to renew our mitochondria by autophagy, by caloric restriction, by exercise. And nutrient is very important in the mitochondria. During electron transport in mitochondria, they need vitamin B complex, B1, B2, B5, B6, B12. They need vitamin E, selenium, coenzyme Q10, taurine, vitamin C, even caffeine is also have pathway that can support in mitochondria. Even melatonin is support in electron transport chain complex 4. So all of this we have to balance everything from micronutrients, amino acid, and mineral to support our factory in our cell to work properly. So when I have my patient, I have to go back to their diet. What is their pattern of diet? Enough nutrient or not? And I may check the vitamin and mineral. And in the elderly, I may check amino acid profile, fatty acid profile to check the level of omega-3 and try to balance everything. To support mitochondria, again, caloric restriction is in every hallmarks, exercise, and supplement that can support. There is another intervention that can help for mitochondrial function is cold exposure. Now you put yourself in the ice bath or cryotherapy minus 110 Celsius for 2 minutes. You have to avoid toxin because heavy metal can block in some pathway in the Krebs cycle in mitochondria. Maintain healthy weight, quality sleep, and for the supplements that can help mitochondrial function is B complex, coenzyme Q10, alpha lipoic acid. This is very good for the one that feel weak, fatigue, or low energy. Selenium, zinc, NMN, taurine is another longevity supplement. There is a paper published last year that in mice, taurine can extend the mice for about 25%. And TMG together with NMN and carnitine, all of these can help to support the mitochondria.
Great recommendations for mitochondrial health. Lastly, let's discuss cellular senescence. What exactly is cellular senescence and how does it impact aging, age-related diseases, and what are senolytics? How might they revolutionize the treatment of aging cells in the future?
Okay, so normal cells can go to be senescent cells. Normally, when our cells divided itself for about 7 or 8 cycles, it will be old cell and it should have some programmed cell death or apoptosis to destroy that cell. But if if the apoptosis doesn't work, so they will have the cell that bigger than normal and it also create some inflammations out of their cell. And we can call senescent cell as a zombie cell. Zombie cell is mean that if the cell that have zombie cell, another cell that around this zombie cell can become the zombie cell or senescent cell too. And the group of senescent cell will produce some inflammation that we call SASP. So when we have this, why we have senescent cells? it's because of other hallmarks before. It's come from DNA damage, epigenetic alteration, telomere shortening, proteolysis, proteostasis, and mitochondrial dysfunctions. And this becomes senescent cell, the cause of senescent cell. And when we get older, the number of senescent cells is more and more. And these senescent cells is the cause of cancer, is the cause of inflammation in our body. So now when we focus to cancer treatment, now some integrative doctor may talk about senolytic. But when we talk about senolytic, we have to think about this. We have 2 points to attack. The first point is senescent cells. The second point that we need to attack is SASP or some inflammation that senescence is released. So with these two, focus to senescent cell first. Senescent cells, now we may know that the DNQ, dasatinib and quercetin is the one that can reduce senescent cells. But I found some paper that show that there is another 2 molecule that can reduce senescent cell is curcumin and fisetin. Quercetin itself without dasatinib may not affect the level of senescent cell, but curcumin alone or fisetin alone can help. Resveratrol is a little bit but not much. So we try to encourage to eat more black tea, onion, broccoli, grape, apple, and berry. In Thailand, we love to have some lotus root. It's also good for senescent cells. And for the SASP or inflammations, so we can give some antioxidants that we mentioned before, like EGCG, apigenin is also good. Curcumin is very good. NAD plus is also help for SASP. So together with this, we can reduce the risk of autoimmune disease, cardiovascular disease, osteoarthritis, neurodegenerative disease, and cancer. So this is about the senescent cells.
So before we conclude, doctor, a piece of advice for the doctors across the globe that you would want them to include when they are diagnosing or treating such cases wherein they want to increase the longevity and wellness of the patient.
So the approach that I take care of my patient, I use the longevity tree. Now, when you imagine that you have a seed, is genetic that we get from our parents, and this genetic is controlled by epigenetic. So the seed have to add fertilizer, add water and soil to make it grow well. This is lifestyle, and this is the environment. Lifestyle is back to diet, exercise, sleep management, stress. And environment, we avoid toxin, avoid smoking, prevent infections. So with this concept, it can be the fundamental to take care of everyone. But when we get older, many function in the body will gradually go down, like hormone after 30 years old. Our gut function include the gut microbiome, our mitochondria functions, our detoxification process, our brain functions, our immune function. So we have to take care of all of these functions together with our fundamental genetic and epigenetic. So we can design the test program. We can check the heavy metal test. And in Thailand, 9 out of 10 of my patients, when we check heavy metal, we found arsenic, cadmium, mercury, lead, and aluminum. So we have to have some treatment like chelation to remove all of these agents. And this can help to protect our DNA, to prevent DNA damage. And for the parts of nutrition, I check micronutrient level. I check the basic one is metabolism, lipid profile, uric acid, fasting blood sugar, A1C, liver kidney function. And I check some inflammation marker like homocysteine, ESR, CRP. And the one who have signs of inflammation in the body, I may check inflammation cytokine like interleukin 6, tumor necrotic factor. And with this information, we decide the treatment. And for the other function that we take care is we check the hormone level, thyroid, adrenal, sex hormone, insulin. For the gut health, for the one that go deep in the health, we do the gut microbiome test to collect the stool sampling and check that what kinds of the microbiome that they have deficiency, and then we give personalized probiotic. And we check the mitochondria function by check the metabolites by urine organic acid. And with all of these functions information, then we create a treatment plan. Start from lifestyle modifications and supplements and other treatment that can help them for longevity. But we need to have some marker to make sure that our treatment is help for longevity. So we check biological age by DNA methylation and telomere length, and include we check body composition analysis to make sure that they have enough muscle mass and can help to reduce their percent body fat. Okay, this is the approach that I can help my patient. And actually there is another test that I check is about the proteomic.
Okay.
Omic size now more and more it can help to know the risk of the disease about 5 years, 10 years ahead.
Thank you, doctor. It was really very insightful. It can not only help the patients but doctors as well to increase their longevity and wellness together. So it's like a holistic approach that you have mentioned. May it be calorie restrictions, may it be exercise. Everyone has to follow this with the supplements that they are taking so that they can live a very healthy and a very long life. And with your insights, I guess not only doctors will include this in their treatment plans, as well as they will include this for them as well so that they can live a very healthy life. So looking forward, yes, please.
It's another point that I like to mention. I read one paper, I think only last month. They mentioned about the emotional, the bio-emotional that should be part of hallmarks of aging too. Because of the psychological, that's another part that linked to the quality of life. And with the complex in our body that link between our mental health and physical health. If we can improve our mental health, it can also help our longevity. Because if we get older and our function is very perfect, but you suffer from everything, you look sad, depressed all the time, it's not good quality of life. So we have to talk about the mental health, talks about how to have mindfulness, be with the present, notice when you breathe in, notice when you breathe out, because breath is that's at the now moment. And if you can practice this all the time, it can help a lot. Even one day you get sick and you go to ICU, but when we have these kinds of mindfulness, you can be in ICU alone with peaceful in your mind.
That was really I don't have actually words to express. Like, your insights are not only intriguing me to say this, but it is like most of the things are related to my own lifestyle that I can modify, and definitely I will do it after listening to your words and your insights on this. I feel like I am not living a healthy life. I should start in using all of these things so that I can live a long and a healthy life. Thank you so much, doctor. Looking forward to having more such insightful discussions with you, because this is not at all like a bit that we have discussed today, but we would want you to come on to the podcast again with some new insights, as well as it will be helpful for us, for the patients, and as well as for the doctors. So thank you so much. It was really interesting. It was full of insights. It was full of enthusiasm to treat your patients. That is reflected by the papers that you are reading every day, and it is actually by the books that you read, so that you can plan the patient's treatment so well and help them. Thank you so much.
Thank you. I hope I will have the next session with you soon.
Sure.
We may talk about longevity, exercise for longevity, or talks about sleep for longevity, with the separate session with tip and tricks that can help you, and some KPI that we have to be part of our treatment plan to take care of our patient.
Thank you so much, doctor. We are really looking forward to that.
Okay.
And we would love to hear your thoughts on MedSynapse. How has your experience been with us? And do you see MedSynapse benefiting the medical community?
For MedSynapse, I like to join the network of doctors that can be share the experience and can help each other to be strong connections. And at the end, the ultimate goal is we like to help people to be healthier, happier. So I think thank you for MedSynapse to create this community and help us to connect and share the experience.
Thank you so much. Thank you, Dr. Narinthorn, for your comprehensive insights into the hallmarks of aging. It's been a pleasure discussing these crucial topics with you. To our listeners, thank you for joining us on this episode of MedSynapse Podcast. If you are also a healthcare professional who would like to voice your insights on our platform, please contact us. Together, we can continue to drive meaningful discussions and advancements in healthcare. Thank you for joining us on MedSynapse. Stay tuned for more discussions on advancing healthcare.